So the people are coming in. We're 2 minutes behind schedule. So what I'm going to do is I'm going to go on ahead, everybody, and begin with our meditation. For those who are new, who may not know, I am Sharon Tubbs. I'm the director of HealthVisions Midwest. I welcome you today. Thank you so much for coming and joining us. We've got some great information that we want to share. But HealthVisions is a faith-based organization. We are sponsored by the Poor Handmaids of Jesus Christ, which is an order of sisters that are headquartered in Donaldson, Indiana. We have 3 locations: Fort Wayne, East St. Louis, and Hammond. And so we like to begin our meetings with a word of meditation or prayer. So that's what I'm going to do right now. If you are not into that thing, please feel no offense, lower your volume, come back in 30 seconds. And rejoin us. So today I thought it would be good to offer up a meditation or a prayer of thanksgiving, because we are in the Thanksgiving season. So many things have gone on this year, but it is great to give thanks, because I think giving thanks and gratefulness, feeling gratefulness, helps us to feel better about our predicament, whatever that predicament is, and to feel better about our world and ourselves. So here we go. Thanksgiving prayer today. Dear Lord, today we give thanks for our many blessings. As we pray for those in need, we give thanks for our family and friends. As we pray for those who are lonely, we give thanks for our freedoms. As we pray for those who are oppressed, we give thanks for our good health. As we pray for those who are ill, we give thanks for our comfort and prosperity as we pray for our blessings with others. On this day of Thanksgiving, may the love of God enfold us, the peace of God dwell within us, and the joy of God uplift us. Giving thanks. Thank you so much. Amen. All right. So again, thank you for coming, and I hope that we find something. I know you're going to find something to give thanks for today. You know what? I just had an idea. In the chat, put something you are thankful for. Okay? Just type something in there that you're thankful for today. I don't see anything blowing up my chat. Y'all not thankful? We can't. Okay. Anne is thankful for health. Emily's thankful for family. The sun is out. Yes. Mary. Laura Dwyer. Thank you, Laura, for my leadership. I don't know about all that, but thank you for being thankful anyway. Peggy's thankful that she's here today. Yeah, so we've got a lot of things to be thankful for. Oh, Jose is thankful for the snow. Ugh. But hey, I guess it's good to be thankful for all things. Where is the snow though, Jose? Okay, Jose's not going to unmute himself. We just have to guess where the snow is. I don't know if that's in Indianapolis or where. Does he want snow? But he likes snow. I am thankful to have people that love me with, to spend Thanksgiving. Yes, Lupita. Co-workers, Amy B, holding us up, that he's in control. Brenda, yes, thanks, Brenda. Thankful for my family and good health. Thankful for life and family. Andra, friends and family, we choose as family. Yes. So, family and friends family is not all about bloodline. Sometimes we can choose people and people that are near and dear to us and call them family. Community partners, Connie. Yes, she's one of our great partners. Okay, Katie's thankful for her family. Okay, so thank you all for sharing something that you're grateful for and thankful for, because I think that if we dig deep enough, we can all find something. So moving right along with today's agenda. Oh, first, wait a minute. First, I want to introduce somebody. This is a familiar face that you all have actually seen before on our ACHEC meetings in person for years before we went virtual. But now she is with the HealthVisions team. We've had some transitions here at HealthVisions in our team. And so I want to introduce to you Patricia Veazey. Patricia? Yeah.
Good morning, all. How are you?
Yeah, so Patricia is with HealthVisions, and she is our wellness coordinator. I'm sorry, Patricia, I cut you off. What were you about to say?
I was just going to say that one of the things that I'm thankful for is to be here at HealthVisions.
And I didn't even pay her to say that. I didn't tell her she was going to get a raise or anything. She just said that all on her own. So we are very grateful to have Patricia with us. Like I said, we've had some transition here on the team, and she is our new wellness coordinator. And you may have seen her throughout the community. She's been doing some things and working with various organizations in the community for years, right? And so I just am just so happy to say that she is with our HealthVisions team now, and she's going to be doing some great things, reaching out to some of you. Joellen is thankful for the health of my friends. Of my friends' newborns. Have 5 friends who give birth this year, new family members this year. Wonderful. Thank you, Joellen. All right. So we're going to move right along with our agenda today. Like I said, we wanted to talk and give some kind of overview of COVID and how some of our partner clinics have fared this year in dealing with this pandemic and crisis in underserved communities. And so they're going to talk and kind of give an overview of what's been going on this year and how they partnered. You may have some data and numbers in terms of how many people that you've been able to vaccinate and the trials and challenges that you've encountered. So let's start with Connie. COVID-19 response, how local clinics reached the underserved in 2021. Connie, did you have slides?
I do not have a slide. I'm sorry, Sharon.
No worries.
I'm Connie Heflin, Executive Director for SuperShot, and SuperShot is a local nonprofit that provides immunizations primarily to children. Our mission is to break down the barriers of access and affordability, and we turn nobody away for inability to pay. In a typical year, SuperShot sees about 10,000 kids. That's closer to about 20,000 kids this year. But when it comes to the COVID response, currently we have standalone COVID vaccine clinics for the 5 to 11-year-olds. And this is in partnership with Parkview Health. And every Tuesday and Thursday evening from 4 to 7, so it's that after school hour, we have approximately 100 appointment slots on Tuesdays and Thursdays from 4 to 7. And then on Saturdays from 9 to 2, we have over 200 appointment slots. And that's all here at our Hobson clinic location. That's 1515 Hobson Road in the 46805 zip code. And we have Burmese and Spanish interpreters available at all of these clinics. But why I mentioned to Sharon that I wanted to maybe possibly speak, what we're not seeing, our appointments are completely booked. It's great. I mean, we're seeing you cannot get an appointment at SuperShot through Saturday. We're typically running 2 to 3 clinic dates out where we're completely booked, which is good. That means there's an uptake, that parents are getting their 5 to 11-year-olds immunized. But we're not seeing a very diverse patient base. And that's why I was really wondering if, I could speak and collaborate with everybody on the phone or on the Zoom to just get ideas and suggestions. This is a partnership, like I said, with Parkview. They're helping with the registration part of it, but it's all of our vaccinators doing the clinical side of it. And we can move people through quick, but we're not seeing a lot of the diverse, our marginalized communities here. So last night we did partner with HealthVisions. We went to Boys and Girls Club and we had a COVID clinic there, COVID and flu. And that was good, but it wasn't, again, we weren't overwhelmed by the attendance. I think we saw 35 people and they were mainly adults getting COVID booster shots and about 5 kids. So, that's a kind of a nutshell what SuperShot is doing. I think they're in this age range of children 5 to 11 in Allen County. There's about 45,000 kids this age. And the last I saw, we had about 6% coverage of their first dose of that age group. So there's a lot of work to be done. We plan to have these standalone clinics through the end of December, and then we're going to see what the demand is. And we are making plans for the remaining, for January, February, but we just, I'm concerned that a lot of our community isn't getting the message. So I do have flyers that I can share with everybody in Spanish and Burmese that has our clinic times and the information and how you register. And we do accept walk-ins because I think the registration piece is it's complicated if you're a non-English speaker. So we accept walk-ins too. And it's, okay, I'll share the flyers. And just so everybody has a bit of a heads up, it's only the Pfizer vaccine that's approved for 5 to 11-year-olds. And it's only the Pfizer vaccine that's approved for 12 to 17-year-olds. 18 and older, you can get a Johnson & Johnson, Moderna, or COVID vaccine. Booster shots, there's a strong recommendation for booster shots, anybody in high risk work, type of work environments. But tomorrow, most likely anybody 18 and older will be able to get a booster shot. I think that's coming out tomorrow. And if you're 6 months out from completing your vaccine series. So that's just a little bit about boosters and so on. So yeah, sharing questions.
Well, what we're going to do, thank you so much, Connie. We're going to hear from Katie, and then we're going to take questions for both of you. And I just want to say, I did get my booster shot last night. And so thank you for that. And it has been interesting, just to piggyback off of what you said with regard to the pre-registrations. Last night, even, most of the people who came were walk-ins, right? So we were standing there at like 4:30 thinking, I hope more than 3 people come, 2 or 3. And then there was like 35 that, came in steadily over a couple of hours. It's 2 hours we were there. So yes, it's very interesting in terms of reaching underserved populations, especially when there's a language barrier. And because many of the people that came were Burmese, we were able to get some of the word out to some of our Burmese partners as well. So Katie, let's hear from you and neighborhood health.
So this whole past year, we actually did our unveiling of our mobile unit, if nobody knew that. And what we did was we supplied COVID vaccines out in the community. So we went to a lot of community events, especially at McMillan Park, to give out vaccines. And we have also collaborated with New Covenant Worship Center, which is actually next to our East Paulding Clinic, to give out vaccines as well. And we did that, I think we started it at the end of July or August. So we've been running that. We've offered the Moderna vaccine. We also have Pfizer for the kids. We are not doing the J&J anymore right now, but I do want to introduce Emily, is it Shamahorn? Did I say that right? Okay, cool. She is our new care coordinator. So she is going to be taking over the mobile unit, and she's also doing the entire project on the vaccines. So Emily, do you want to speak a little bit about that?
Sure. So my name is Emily. I am the RN care coordinator here. We have our last day at the New Covenant Worship Center will be the November 30th. So we are vaccinating people 12 plus there. And we're also vaccinating pediatric patients of ours during office visits. We haven't seen a whole lot of demand for that. We've only vaccinated, I think, 4 or 5 since Monday. So we're hoping that picks up a little bit, maybe with some strong provider referrals and things like that. That's all I really have. We might look at doing some outside clinics for children if we have the demand. But that's all I really have.
Do we have any future plans with the mobile unit right now, other than, taking that out for those types of events for the vaccines?
We don't have anything kind of, permanent in writing, but we would like to start possibly doing telehealth visits from the mobile van at some point. So there's a lot of work to do on that as far as getting the technology set up and the staff and how that would work. But that's what we're possibly looking to do with the mobile unit, as well as keep providing, vaccination clinics and, those go to the fairs and preventative measures and things like that.
And we also supply interpreters as well. We have Spanish and Burmese on site. And I know in the past they have come out on the mobile unit with us, to break that language barrier as well. So that's another thing that we can offer. And I also want to say, Emily is going to be taking over this entire project. My last day at Neighborhood Health is Wednesday before Thanksgiving. I will be moving on to a different company as a writer, which is something that I've been very passionate about. So yeah, I've enjoyed working with all of you and getting to learn about your organizations. It's been a wonderful time these past 3 years.
Well, we certainly wish you well, Katie. You have done such great work in partnership with all of us. And various events. We could always count on seeing Katie Murray from Neighborhood Health and spreading the word about what is going on. So thank you so much for all that you have done, and best wishes in your new position.
Thanks. And I also want to add real quick that our community health workers will be taking over events now, if you haven't met them yet.
Okay. Well, hopefully we will see them out and about. And so I do want to ask you and Neighborhood Health and Connie to talk specifically about some of what strategies first of all, what problems did you see in the beginning of this vaccination effort? I'm talking about way back in February and March. What were the obstacles to reaching underserved groups? And then what strategies did you implement to rectify that, to overcome some of those challenges? Katie?
Well, in the way beginning, some of the challenges was definitely the language barriers. That was a huge one for us. And also the lack of education about the vaccine, that was another huge barrier. So that's when we hired our community health workers to help us go out into the community and spread that information. And we did see an uptick, I think it was about September maybe, in people wanting to get vaccinated. But other than that, it has slowed way down.
Mm-hmm. Connie, what are some of the challenges that you saw, and then how did SuperShot try to overcome those challenges?
Again, it's at first you're going to get that uptake of the early adopters that really want this vaccine and that are looking for it, and they're taking those appointments. So that demand peaks right away, and you're trying to keep up with that demand. And then that quickly wanes, and then the hard work happens, and we need to start rolling up our sleeves. And so it is breaking down the language barriers. It's working with trusted partners. So there's a lot of faces on this Zoom, just have been great partners, because it takes, like I've said, SuperShot we have access to all the immunizations. We have amazing vaccinators. We are the second largest pediatric immunizer in the state of Indiana. So we are a trusted partner, but we don't have the day-to-day relationship that some of you do with the families that really need our services. So working with trusted partners really has worked. Catholic Charities, are they on here? Catholic Charities partnered with us at one of the Burmese apartment complexes, and they went door to door, knocking on the door, saying you need to get your COVID vaccine. They were a trusted messenger, trusted partner, and we saw over 50 people that day in 2 hours. So that was one of our best. And besides our other HealthVisions, that event we had here this summer, HealthVisions really got the word out, and they worked their Latino and Burmese relationships in the community, and those communities came. So it's really working with trusted partners. And that's why I said, well, I really, that's how we have to break this down. I don't think one agency can do it all on their own. And, just welcome anybody if you want to, talk about it and figure out what we can do together. I welcome those conversations.
Thank you so much, Connie. I think Connie hit the nail on the head, and Katie as well. What we found during this pandemic is the power of partnership. And I think we need to utilize that more as a coalition, as organizations, coming together to combat many of the things that we see, these disparities that we see in our communities, because we're better as a team. And you know, we have these great organizations like Neighborhood Health and like Super Shot, who may not have the direct contact with some of our underserved communities that our organizations do. And so what we did, HealthVisions, earlier this year, and I've mentioned this a couple of times in the coalition, is that we did assemble that the vaccine messaging task force. So Felicia, if you can pull up some of we had a PowerPoint, and I was just, as you guys were talking, I was just thinking about some of the things that we've done. I don't think that I've shown these slides before in this setting. I can't remember. So if I have, forgive me. But I wanted to just show you, this is a slide presentation that we did a couple of months ago. And within the slide presentation, we talked about the power of working together with other organizations. So the impact that we had with these organizations was this: we were able to partner with other organizations, and the total vaccinations that we did together at various events was 880 plus, okay? Through these partnerships, and this was just through the end of September. We have to update these numbers. 880 vaccinations in the Southeast area. Vaccination registration. So before we did the mobile vax units back in March, April, May, before organizations were actually coming to different sites, we were going around and taking laptops and registering people, or opening up our doors at churches and various venues to register people for the vaccines. And with that, vaccine registrations, there were 558 through partnerships. Information distribution, we were distributing credible handouts from the CDC and other resources to people. And so I think this number is actually low because some of it wasn't counted, but we did 403. And then with our webinars, Facebook Lives, COVID-19 video campaign, we did a video campaign with PSAs. We were able to reach more than 26, there were more than 26,000 views with that, not counting TV spots. So those messages went out on television, and we weren't able to grab those numbers as well. Back in the day, if y'all can even remember this, it seems like years ago now, but last June, before there was COVID-19 testing in the Southeast, we were able to get a partnership with the state to offer COVID-19 testing in the Southeast at the Urban League. And there, 374 people were tested. More than 9% of them were positive. So that shows you, and again, these numbers are old. These are as of what, mid-September, I think, Felicia. But this shows the power of partnership. And so Felicia, I think you can stop sharing the screen. But this shows the power of partnership with other organizations. And so I just wanted to share that with you, that this pandemic has brought out a lot of different things that we need to pay attention to in our community. And one of them is the power of partnership, which is actually a positive thing. And so I hope that as organizations, we can not just come on these calls and, hear what each other is saying and then go on about what we're doing in our organization, but actually come on these calls and hear what is happening in these various organizations and start thinking about ways that we can partner for a greater impact in terms of our services and programs. Because I'm telling you that when you begin to partner and when you begin to look at what other people are doing that your organization may not be doing, but that the people you serve actually need, then there's a power in what we're doing, okay? because none of us can do this alone. None of us can serve, you know, the underserved people alone by ourselves. We just don't have the staff. We don't have the know-how. We don't have the expertise. We don't have the resources. But together, we can do great things. And so I think that some great things have been done through these partnerships, and I just want to encourage you to keep that going. We, HealthVisions, we have decided to disband the vaccine messaging task force that we had assembled. We met some great people, great partners. I think that in the end, there were over 40 organizations, representatives from over 40 organizations that did participate at some point or other. And those organizations, the beauty of it, they met other leaders that they would not have met, that they wouldn't have partnered with, that they didn't know before. And so now it's like NAACP was partnering with Connie, and then Kayak Church was partnering with Community Harvest. And so it was such a beautiful way to get people connected. And so now with COVID going on and on and on, we didn't know it was going to go on this long. We've decided, okay, we've made these partners, we brought people together, partners have come together, they have the contact information, and they can continue to do things on their own or with us. But we're going to try to fold people who are not a part of ACHEC. Some people were part of ACHEC, but fold people who are not part of ACHEC into this coalition, because we're going to be just migrating some of our COVID response into our everyday response to health disparities, because it's still here and it's not going away tomorrow. And so that is another condition where underserved people are disproportionately represented. And so we want to make sure that we incorporate that into our everyday services. So I am getting off my soapbox now. Does anyone have anything else they want to add or questions for Connie and Katie regarding COVID-19 response and the vaccinations and where we go from here? Any question? Come on. Is stuff in the chat? Felicia, Peggy, somebody? Patricia? Let's see here.
Not yet, but Connie has sent me her flyers, so I'm gonna download them and put those in the chat for you all.
Okay. All right. So those are going to be there, and we can send those out as well in our follow-up email. And also we're going to send a survey out in our follow-up email that we need you guys to fill out for our Indiana Minority Health Coalition, getting credit for this as part of that coalition. And we got some upcoming stuff. So if there are no more questions, were we thorough enough that we just answered all of your questions? Everything is over. Y'all are okay. Y'all are well informed on vaccinations. Okay. All right. So Felicia is going to talk a little bit about next on the agenda, ACHEC updates. Felicia's got some things she wants to share with you.
Yeah, so we have a very exciting thing to share. So we are going to have an ACHEC appreciation morning. So we know that people have paid their dues, and in past years we've had like different breakfast things. And this year, you know, we tried to have some in-person events, but due to COVID, we had to cancel them. And so this will be a time where we can just say, you know, thank you for being a partner. Thank you for being a member of ACHEC. But then we can also get to see you in a social distance way, and then also provide you with some goodies. So this is an event that's going to take place on Thursday, December the 9th, from 8:30 to 10. And so we are going to do a drive-through giveaway. A drive-through, like both a giveaway, but also a hello, so good to see you, kind of in person, still distance, but we're trying. We are really trying. We have been sitting together as a team to think of how can we, you know, really extend our gratitude to the ACHEC team. And so this is what we've come up with. So I will be sending out an invite as we get a little closer. And I would really appreciate if you can RSVP to that invite so that we can plan accordingly. But like I said, that'll be on Thursday, December the 9th from 8:30 to 10, and it'll take place at in the parking lot of our office. So here at HealthVisions, which is located at 2135 South Hannah Street. Is there anything I missed?
Well, Felicia, just to clarify, they don't have to be here all that time. They're just going to drive through at some point during that time.
Yes.
Yes. So you're going to drive through. We're going to give you a baggie with some goodies. Then remember that T-shirt that we promised? It's going to be in there. And then we've got some other great ACHEC swag, all new and wonderful and one of a kind. Don't try to sell it on eBay though, but it's going to be wonderful. Okay. And some breakfast goodies, right?
Yes. So we are super excited. Definitely still just trying to make it as COVID friendly as we can, but we do definitely want to see you and to say hi. Just see you in a closer environment than over the screen.
Yes. Wonderful. Felicia, you have any questions about that? Okay, that's clear. Felicia, you had something else.
Oh, yes. So the other item that I wanted to share, so some individuals have sent me their news, and so I'm going to be sending that out shortly. But I know that Colleen has sent me an item. So Colleen, would you mind telling us a little bit about the event that you have coming up?
Yes, thank you. Hi, everybody. I came a little late. I was in another meeting, but great to hear about the immunization piece. Yes, I have a 2-day suicide intervention training coming up. It's called ASSIST. It stands for Applied Suicide Intervention Skills Training. This is a training that is more for caregivers. So if you are in a role where you get referred to, people who are struggling are referred to you, like a school counselor, a pastor, a social worker, or if you're a community health worker, or you may be the person in your family that everyone gravitates towards for support. And maybe you have a family member with mental health challenges or someone who's had chronic suicide thoughts. That's what this is, more of an advanced suicide prevention training, where it teaches you a hands-on intervention model, which also comes with safety planning. It's 2 days because there's a lot of hands-on work with this model. You learn a full model and then you learn how to implement it, and through simulations get to practice it as well. It's the same evidence-based training that the National Suicide Prevention Hotline workers get. And it's really the only evidence-based suicide intervention training out there. So I'm going to be offering that at Sweetwater Sound in their beautiful conference facilities, December 15th and 16th. So if you all are interested, I guess I can put my email in the chat, but there's also a flyer that Felicia has that I sent her that if you get a chance to send it out, wonderful.
Colleen,
Thank
is there
you.
a fee?
Yes, it's $185 for the 2-day training, and there are CEUs available for mental health folks who, often need them, right? And that comes with lunch both days and snacks and coffee. So you're well cared for during this training.
Thank you so much. That's awesome.
Yeah.
Okay, Felicia, did you have anything else regarding news and events?
Yes, so then I have 2 more to share with you all. So these are both from Purdue Extension. And so there's one called Maintaining Mental Health During the Holiday Season, which will take place on December the 2nd from 11 a.m. to 12 p.m. And the second one is about staying scam safe. So we know that technology has made it kind of easier for scammers. So how we can stay scam safe. And that's on Wednesday the 24th from 10 a.m. to 11 a.m. So I will be sending those out.
Yes. So Felicia, when is the deadline for people to make your news and events listings?
That's so I like to have them 2 weeks in advance from the actual date. And I'm sorry, but I'm going to be sending out the next group of event listings today.
Okay. So you better hurry up. Okay. If you have something, you better hurry up and get those into Felicia. Jared is on the line from Purdue Extension. Jared, did you have anything to add regarding Purdue Extension in your upcoming events? Or is that under Kidani? Well, apparently Jared's face is on the line, but he may he may have stepped away. So we'll just go with that. All right. I have a couple of things with HealthVisions that I wanted to mention. As you saw in our agenda, the next meeting is January 26, 2022. So, I mean, this year is just flew by. So we will not, of course, meet in December, but we will meet next in January. And next year, our meetings will return to Wednesdays. If you'll recall, the only reason we started having them on Thursdays was because we didn't want to conflict with the United Front effort that was on Wednesday mornings. So we will start back again on Wednesdays, and hopefully we will see then our January 22nd meeting. For now, we're planning to still be virtual. We will let you know if that changes so that you can all come in and eat a snack and network together again. Okay, let me see if there's anything else. Okay, I want to give you guys a heads up. In 2022, we're doing some great things. And so I just want to put this out there. One of the things that we are going to be doing in 2022 is we're going to host a health equity conference. Okay, health equity conference. I've not seen anything like that in Allen County. But we are a neutral party. We're, of course, we don't work for any of the hospitals or anything like that, clinics. We want to bring people together. We want folks from the hospitals to be here and join us. But we want to talk about health equity. We want to bring people in and all come and share together ideas. And so we're going to have a speaker at the conference. We are going to give out an award for a volunteer. You'll be hearing much more about this in the coming weeks and months, okay? Because we want you guys to nominate folks for this. We want you all to be a part. We want folks to sponsor tables. So we got a lot going on. And so we hope that all of our healthcare providers will take part and support this effort to get the word out and to raise awareness about health equity in Allen County. I think that health equity, and I know you all see it and know it, health equity should be on the forefront of our conversations, okay? This should be big talk here in Allen County with all of the things that are going on and the people who need service and care. And so we want to raise awareness about health equity. We want to help change policies, and we're going to start doing that more so. We've been doing it for a while, but we want to start doing that more so next April with our first health equity conference. Okay, any questions?
Sharon, Jared did have something in the chat. He said his microphone wasn't working.
Oh,
And
okay.
he said those events are provided by Kiani, and I would like to introduce our new nutrition education advisor, Amy.
Oh, where's Amy? Oh, Amy B. That was
Yes.
Amy B.
Yes.
So yes, before everyone was on, Amy B introduced herself to a few of us. Is Amy B on now?
Yes, she is.
Where's Amy B? Oh, there's Amy. Hi, Amy. You want to share a few words with us?
Can you hear me?
Yes.
Okay, I finally got it to work. Yeah, I'm Amy, and I work with the Purdue Extension Office as a nutrition educator. So I teach nutrition classes to SNAP recipients or those eligible for it, just at different organizations in the community, schools, and we just teach on topics like just basic nutrition, food safety, things like that. And we also try to connect those people to other organizations as well that could help them. So
Amy, welcome to the
Thank you.
coalition. And we are grateful for your service and all the things that you are doing to improve nutrition and health. You yourself, as well as Purdue Extension as a whole, which is a wonderful partner. Okay, so that's all I have. Am I missing anything? Patricia, Felicia, Peggy, am I missing anything? Lupita? Okay, I'm not missing a thing. That means it's time to open it up for partner news. What's going on with all of you? We've heard from Purdue Extension. We heard from Colleen and the suicide training, prevention training. What else is going on out there?
I would just like to let people know that we are hiring for nurses and other various positions. So if you guys know some RNs or nutritionists or breastfeeding specialists, please send them our way.
Thank you, Katie. Who else? Don't be shy. Connie?
I know we've been talking about immunizations, but Super Shot, we also do routine immunizations. It's all been about COVID lately, but a big part of what we do, the main part of what we do typically is provide routine immunizations for children. And we've just recently started a collaboration with the Shepherd's Hand and in conversations with some other nonprofits to provide diapers to parents, to families that keep their babies up to date on their baby's immunization schedule. So babies 0 to 36 months, if those families bring their babies in on time for their immunization schedule, they will get an allotment of free diapers. So we'll have more information on that. But if you're dealing with any parents and any families that need diapers, and they need to get their kids immunized, we do have that here. And it's we're just trialing the partnership, but have intents to run it all through next year. And then we will assess if it improved so just to give people a little bit of background, that's how our local or all immunization rates are calculated by the CDC for counties. It's based on 0 to 36 months, and if babies stay up to date on their immunization schedule. And Allen County falls in the lowest 10 counties in the state of Indiana for our local immunization rate. So we're really trying to move the needle, and how to do that is to get parents to understand the importance of bringing their kids on and getting their kids immunized on time. So yeah.
Okay, thank you, Connie. And I just wanted to say, just to highlight what we've been talking about today as far as the immunizations and the COVID-19. I neglected to mention, I wanted to share with you guys the need for ongoing access and awareness efforts regarding COVID-19. I do have some data from the health department, and this is as of November 12th. The targeted zip codes that we were trying to raise awareness and access, Southeast 46803, 46816, and 06 are still all below 50% in terms of people being vaccinated in those areas. So in 03, the rate of vaccination is one of the lowest in the county at 34%, okay? It is not the lowest, because there are some rural areas where vaccination is even lower, and that's Grable, which is only at 23%. Okay, but in 46803, the rate is 34.15%. In 46806, the rate was 39.78%. And in 46816, 49.2%. Now, just to compare, in 46814, which is Southwest, the rate is 87.46%, okay, of vaccination. People in those zip codes who are in that zip code who are vaccinated. In 46845, the rate is 75%, okay? I actually thought it was higher than this. I think some numbers have changed around, but
Yeah.
But
They've gone down because they added the 5 to 11-year-olds in those numbers.
Oh, thank you. Because I was like, wait a minute, a couple of weeks ago was up in the 90s, but they added the 5 to 11%. So thank you, that clarifies it. So, look at that disparity. Look at that gap from one area where the rate is 87% and the other where it is 34%. Okay, so we still need, to raise awareness and access. Of course, we're not saying to force anyone to get a vaccine, but we just want to raise awareness and access, because I think some people would be vaccinated if they had the access, if that language barrier wasn't there, which we found,
Okay,
and if they had information. Okay,
okay.
who else has something else going on? Dr. Johnson, are you trying to say something? Okay.
No, you answered it. I was going to ask, what do you think were some of the reasons that was causing the disparities? I am in the 46783, 83, which is Roanoke, but right 5 minutes away is 46804. And that's still Southwest Allen, which is the 46814. So I was going to ask, what do you think some of the reasons were for that great disparity between this side of town and the other side of town, meaning more the south side, but you answered it.
Yeah, there's just that resistance at this point, where people are really, some people just fear getting the vaccine, and they, or there are conspiracy theories out there,
Yes.
and there are language barriers.
Mhm.
So all of those things are in play. In 46804, by the way, the rate is 62.2%. Yeah.
Okay. Now, Roanoke, is in Allen County. So do you ever have any numbers for Roanoke? I'm just curious.
61%.
Okay. All right. Thank you.
Anything else that we would like to add of what's going on in your organization?
I would like to add something if I could, please.
Yes, ma'am.
All right. I would just like to give everyone a heads up. I am working on a webinar. As you know, we're coming up into the most stressful time of the year. So we're going to do a webinar talking about stress, how to deal with it, ways that we could take a moment at our desk or a moment at home to just kind of inhale, exhale to get us grounded again. And so we can push through these holidays. And it's entitled Stressed to Blessed. So we're going to go from stress to being blessed during the holidays. Look forward to that. It's going to be December 15th. More information will be coming.
All right. So y'all look out for that. Spread the word. That's going to be an awesome webinar that Patricia is leading with some local leaders. And so we are looking forward to that. Anything else? Anybody else have a nugget of news you want to share?
Karen Colleen has something in the chat.
Okay, what is it?
She forgot to say, excuse me, that full scholarships are available for the assist program that the suicide program they're hosting for those who have mental illness, whose family members do. So there's a scholarship, a full scholarship available.
All right. Thank you. Thank you, Colleen. Anyone else? Nothing. Y'all aren't doing anything at these organizations. Y'all are just chilling. Be giving thanks, being grateful. Okay. All right. So I know that's not true. I know that you are doing plenty of things. And so I just want to thank you guys for coming on today. And again, we hope to see many of you December 9th for our Appreciation Day. We hope to see some of you and spread the word for December 15th for our stress tips for women, stress to blessed during this holiday season. We will be distributing, of course, the flyers and other information that you send to us. We'll be distributing that to the coalition, and also you'll be getting the news and events shortly from Felicia. So if there is nothing else, you know what? I'm going to give y'all 9 minutes back of your day. And we just hope that you have a wonderful holiday season and rest of the year. Felicia, are you holding up your hand?
Yes, I remember we had talked about sharing that. So if you've ever missed one of our meetings, or we do record these and we put them on our YouTube channel. So I've been trying to send them out, once a month for people who have missed them, but definitely you can go ahead and subscribe to our channel. We'll have the coalition meetings there, but then we've also been trying to do more videos of our community health workers and different things that we're doing in the community. So be sure to check it out. It's called HealthVisions Inc. on YouTube.
So what we're going to do, because we want all of y'all to subscribe, not only do we have ACHEC meetings on there, but we have plenty of other good stuff that you can share, resources to share and all that. So we're going to send you the link to our YouTube page so that you can just click on that and subscribe. Won't that be easy? Yay. Okay. All right, so we are, Jared's raising his hand. Yes, or is he clapping? He's clapping. Mary's clapping. Yay. All right, thank you guys so much. Have a wonderful holiday season. Be thankful and grateful, and we will see you hopefully December 9th. If not, we'll see you again January 26th. Bye-bye.